Hello everyone and welcome back to revise GCSE history.co.uk. This is the second video in the topic of Renaissance medicine. In this video today we're going to be looking at the work of three individuals who lived and worked during the medical Renaissance. And if you think back to the last video, when we're talking about the medical Renaissance, we're talking about the period from 1450 to 1750. There we are, nice and big. That's when the medical Renaissance was. So, the three Renaissance individuals, who were they? The first was Andreas Vesalius, or just Vesalius. The second was Ambroise Paré, or you might say Pare. The third was William Harvey, or Harvey. They're the three key individuals who lived and worked in the Renaissance that you need to be aware of and know what they are famous for. You need to be able to explain why these three individuals, Vesalius, Pare and Harvey, are important in the history of medicine. Let's make a start. The first individual we're going to be looking at is Andreas Vesalius, and he worked in anatomy. So Vesalius studied anatomy. He became professor of surgery and anatomy at Padua University. He actually ransacked cemeteries. It's quite hard to say that, for bodies. So at the time when Vesalius was knocking about, and this was sort of the early 1500s, human dissection had not gained acceptance. It was not permitted to dissect human bodies. So what Vesalius actually did is he went to cemeteries and dug up bodies to dissect. So he dissected bodies and wrote books on his observations using accurate diagrams to illustrate his work. His most famous book that he wrote was On the Fabric of the Human Body, and that was written in 1543. On the Fabric of the Human Body, 1543. There's a date there. I've been saying in earlier videos, don't worry too much about dates, but from the Renaissance onwards, you need to start learning key dates. That is an important date that you need to know about, and I would suggest that you learn it. 1543, On the Fabric of the Human Body. You need to know the name of that book, and you need to know the date. Make sure you learn them. 1543, not bad because it's 1543. It's going down, isn't it, the number? If you can't see that, don't worry, not explained very clearly, but 1, 2, 3, 4, 5, it's 5, 4, 3. It doesn't matter if you don't get me. So what Vesalius did is he pointed out some of Galen's mistakes, and he proved that there were no holes in the septum. If you think back to the work we've done on Galen, and you may wish to go back to the Galen video and revisit this work, is Galen said that there were holes in the septum of the heart that let blood pass from the left to the right side, but Vesalius managed to prove that there are no holes in the septum of the heart, and Galen is wrong. Another mistake that Galen made is he said that the jaw is made up of two bones. He was deceived as he had to dissect apes and pigs rather than human corpses. Vesalius had the chance to dissect human corpses, and he discovered that the jaw is made up of just one bone, hence proving Galen wrong. And the main thing that Vesalius did, and this is probably why he is so important in the history of medicine, is he encouraged dissection. So, before we look at the next individual, which is Ambroise Paré, we're going to talk a bit about barber surgeons. So Ambroise Paré, you don't have to put the accent in the exam if you've not got time. Some people call it Pare, some people call it Pare. It's actually Pare, but you don't have to say it like that. So Pare was originally a barber surgeon, before he became an army surgeon. He was his brother's apprentice. His brother was also a barber surgeon. Barber surgeons were medical practitioners who performed surgery, often on wounded soldiers. They carried out bleeding, extracting teeth, selling medicines, and performed surgery, and of course they cut people's hair. This is why when you go to the barbers today, you still see this red and white pole. So today a red and white pole is used to identify a barber shop where you have your hair cut. This was originally intended to reflect the blood and napkins that were used to clean up during bloodletting operations which were carried out by barber surgeons. So the red is symbolising blood, and the white is showing the napkins that were used to clean up during bloodletting treatments. So Ambroise Paré and his developments made in surgery. So, he was originally a barber surgeon, but he later became a battlefield surgeon. We're going to have a different colour, we've used this one for ages now. Later became a battlefield surgeon. In battle once, he ran out of boiling oil, which was used to treat gunshot wounds. And what he did, he mixed together an old Roman ointment of oil of roses, turpentine, egg yolk to treat the gunshot wounds. You do actually need to know the ingredients in this Roman ointment, and it is useful for you to know that. So, once in battle, by chance, he discovered an ointment that could be used to treat gunshot wounds instead of using boiling oil. Pouring boiling oil into the gunshot wounds of a patient would be excruciatingly painful for the patient who was already quite distressed. So it's a bit more humane to use this Roman ointment of oil of roses, turpentine and egg yolk to treat the gunshot wounds. So that's one of the things he did. He got rid of boiling oil and its use in treating gunshot wounds by developing an old Roman ointment. Also, he developed a new way of sealing wounds. At the time, a hot cauterizing iron was used to seal wounds or severed blood vessels after an operation. This would be excruciatingly painful for the patient who was probably already quite distressed. But Pare developed ligatures to seal the wounds, and this was much more humane. That's the second development he did. Pare also carried out an experiment with a cook to disprove Galen. He proved that the bezoar stone isn't a treatment for poison. So at the time in the Renaissance, people believed that the bezoar stone was a treatment for any poison. They believed that it was an antidote, something that counteracts and cancels out any poison. In a later video, we're going to be looking at this and people's belief about this in more detail. But Pare carried out an experiment to prove this belief wrong. A cook had been thrown into prison for stealing fine silver cutlery, and the cook was sentenced to execution. And Pare said, "Look, you're going to die in the morning anyway," to this cook. You either drink this poison and I'll try and heal you with the bezoar stone, and you might walk free if it works, if it does actually work. If not, you're going to die, but you're going to die in the morning anyway if you take this poison or not, so you've got nothing to lose. The cook drank the poison, thinking, no to lose, going to die in the morning anyway. If not, if by some chance this works, I won't die. So drinks the poison, and he dies in terrible agony because Pare uses the bezoar stone to treat the poison, but this proves that the bezoar stone is not a treatment for poison because the chef dies in extreme agony. So this proved wrong a popular belief at the time, so that's the third thing he did. Fourth and final thing you need to know about Pare is he writes notes on surgery in 1564. Learn that date, you need to know it. And he became surgeon to 4 successive French kings. So he wasn't just surgeon to one king, but 4 successive kings. So that's everything you need to know about Ambroise Paré. The third Renaissance individual is William Harvey, and he did some work on circulation. So Harvey worked out that it was impossible for the blood... Sorry, let's correct that error. He said that it's impossible for the blood to be burned up in the muscles and recreated as Galen claimed. If you think back to the work of Galen, the third mistake that Galen made is he said that blood is created and burned up by the muscles. He said that a fixed volume of blood does not circulate the body, and instead blood is created and used up. Harvey worked out that this is impossible for the blood to be burned up and recreated as Galen had claimed, and in 1628, you need to know that date, another date you need to know, he publishes a book called, long title but you need to know it, An Anatomical Account of the Motion of the Heart and Blood, which scientifically proved the circulation of the blood. He proved that a fixed volume of blood circulates the human body. Harvey also identified, this is the first thing he did, the difference between arteries and veins, and becomes doctor to the king. But this is sort of interesting here, this point. Although Harvey proves that blood circulates, sorry, that's appalling, let me just change that. Bleeding operations are still carried out, so they continue as people are unsure of what else they can do to heal patients. After the work of Harvey, we will come on to this final point in a later video on medicine in the 20th century, but after the work of Harvey, early blood transfusions were attempted, but they often ended disastrously. The main reason for this being that people did not know about different blood groups. And in 1901, blood groups were discovered by Dr. Karl Landsteiner, and this finally makes the transfusion of blood successful. Again, we'll come on to that in a later video. All you need to know for the work on the Renaissance is that after the work of Harvey, blood transfusions were attempted, but they often ended disastrously. So that's everything you need to know about Harvey. There we are, so that's all you need to know for this video today. Here are 4 quick questions based on the content of today's video. You may wish to pause this video in this position now and have a go at the questions yourself. If not, carry on watching and we'll do them together. Question 1. What was the name of Vesalius's book and when was it published? The book was called It was called On the Fabric of the Human Body. And that was published in 1543. That's a date you need to know. Give 2 medical developments made by Ambroise Paré. He made Roman ointment, and that was as a treatment for gunshot wounds. So, if you can remember, at the time, gunshot wounds were healed using boiling oil, but Pare invented the Roman ointment. Well, he didn't invent it, but he put it into practice, the Roman ointment. And also, another thing he did is ligatures, and that's to heal severed blood vessels or just to heal wounds. Sorry, a bit slow there. What was the name of Pare's book and when was it published? The book was called Notes on Surgery. It's actually a French name. The actual name for his book is French, but I think you'll just be fine calling it Notes on Surgery in the exam. A few examples that I've seen have just said that. And that was published in 1564. Final question. There we are. What was the name of Harvey's book and when was it published? Long title for this one. An anatomical account of the motion of the heart and blood, and that was published in, let me think, 1628, that one. I had to think for a second. So there we are. They're the answers to the quick 4 quiz questions for this video. As you may notice, there's a lot of focus on people's books and when were they published, but that's the stuff you really need to know, and that is the stuff that is sometimes actually forgotten by GCSE history candidates, but it's crucial that you know it and can recall it in your exam. Thanks for watching this video today on the 3 key individuals in the medical renaissance. If you'd like to head over to my website, revisegcsehistory.co.uk, a complete list of videos for GCSE history can be viewed on the website, and you can also access a comprehensive range of other revision materials. Thank you for watching this video today, and I hope to see you again very soon.